Africa has responded to the COVID-19, and I believe much better than most parts of the world, particularly when you consider its relatively weaker resource base. For a continent of 1.2 billion people, we have about 400,000 confirmed cases and just a little bit over 10,000 deaths. Every single life that we lose is unfortunate. But we must also thank God that we have been in a position to reduce the death rate that has been associated with many other parts of our globe. Indeed, if we compare the number of people that we have lost, that is about 15% of the cases in the United States and 7% of the number of deaths that have occurred in the United States. Without doubt, there is no room for complacency, because despite our best efforts, the fact of the matter is that the pandemic is likely to get worse in the coming months, and we need to actively prepare for a looming crisis. We need, as a continent, to continue to learn from each other, to use data to guide our decisions. We need to remain pragmatic about managing containment measures and always maintain regular and transparent communication with our citizens, because at the end of the day, it is our citizens who are going to be critical in fighting this pandemic. I'm working very closely and hand in hand with religious organizations whose influential voices in shaping personal and community responses to COVID-19 is essential. In addition, religious organizations provide critical outreach to our most vulnerable households and have an extensive network of faith-based health and education infrastructure that I believe will be critically important in us being able to respond to this disease.